What is up, my beautiful knowing truth speakers? This episode is brought to you by Painless Pregnancy. Painless Pregnancy is a group of physical therapists located in South Florida who specialize in helping pregnant and postpartum women prevent dysfunction and heal in the comfort of their own homes. This concierge service has been a game changer for me after my third childbirth, and I am excited to partner with them and offer our listeners 10% off of their first in-home visit using my code NikkiSpo10. Stay tuned to learn more. Thanks to Sana Skin Studio for supporting the No podcast. Sana is a skin studio that is shifting the relationship with your skin and your products through goal-driven facials, real guidance, and clean skincare. Stay tuned for our promo code so you can receive $25 off of your first facial at Sana Skin Studio. Welcome to the No Podcast with me, Nikki Spo. Welcome, everybody. You are listening to The No, and I am your host, Nikki Spo. You guys, The No is not about knowing everything. It's about knowing ourselves. And one of the many things that I have gotten to learn about myself over the last few years of birthing children is the importance of prenatal and postpartum care, especially when it comes to mental health, but also something that is far less spoken about, pelvic floor health, which is why I am so excited to host my friends who have been treating me personally at Painless Pregnancy. Yep, that's right. Today we have not one, but two badass doctors on the show today, Dr. Kat Vigo and Dr. Luly Diez. Dr. Kat is the founder of Painless Pregnancy and a doctor of physical therapy, specializing in the pregnant and postpartum woman. Dr. Luly, who is my personal therapist, also boasts a doctorate in physical therapy and is the founder and manager of the Miami branch of Painless Pregnancy. We are going to talk about how it is not normal. Not normal, ladies. You hear me? It is not normal to pee your pants or pee when you jump, etc., or have painful sex. It is not normal to keep looking bloated and pregnant months after giving birth. You do not have to live this way. So listen, this episode is probably going to get graphic, but this is the shit that you need to hear. And this is the stuff you need to hear about taking care of yourself while you're pregnant and recovering from giving birth, okay? This is the stuff that they don't cover at the hospital, and maybe your doctor doesn't have the time or the expertise to properly address, okay? So we are talking about all the down there and all the up here and all the all around things with Dr. Kat Vigo and Dr. Luly Diez today. Lego. All right. So Dr. Kat, Dr. Luly, welcome to The No. I am so freaking excited that you're here and that we get to share your wealth of knowledge with my audience. Hopefully we are going to be able to help a ton of women with this conversation. And I'm just really so excited to have you here. So thank you and welcome.
Thank you. Thank you for having us.
Yes.
We're super excited.
Yes, it's amazing. This stuff really, we need to start like spreading the word on this conversation because people are like scared to talk about it. It's kind of weird, but anyway, first and foremost, I want to give each of you a moment to share like the Cliff Notes version of your birthing stories, because for both of you, it's what has led you to your passion for prenatal and postpartum physical therapy. So Dr. Kat, go ahead. Tell us about your birthing and postpartum experience.
So it really started with my son. He's going to be 11 in January. But when I conceived him, first I had some minor complications at the beginning. They said no exercise for almost my whole pregnancy. And when I went to deliver him, I was healthy. I was fine. I was 39 weeks pregnant. Kind of scared.
Normal, right? Like, right?
Oh, yeah, absolutely. 39 weeks along, no signs of any problems, and was strongly encouraged to be induced for very little reason. And that ultimately ended up in a 4th-degree tear for my lady parts, which if you're not familiar with those terms, that means straight through. Oh, we should show them.
Oh, yeah.
Would you love to see a
Yes, we do video. Show us.
Would you love to see a visual of how that went down?
I want to see the visual, yes.
So yeah, this is the space, I think. Thank you. She's hold the vagina.
Yeah, I got to hold the girl. She's been through a lot.
She's been through a lot. Yeah. So that means from the bottom of your vaginal space all the way through the rectal tissue, okay?
That's a 4th-degree tear.
Yeah.
Yeah. Fourth degree tear.
One hole to the other.
From one hole to the other.
It's now a
literally
giant.
That's horrifying. Like, that's horrifying.
It was horrifying. Yep. Yeah. Oh, yeah. And I was 27, fit, like healthy, otherwise fine, right?
I'm gonna cry for you. I'm like,
yeah. Thank you. It was brutal. And I was a physical therapist, right? So my job involved lifting, pushing, pulling, caring for physical bodies with my physical body. I couldn't keep my pants dry in any way after I had him. So
how long?
Oh, it was a long time. So at least a year to recover from that, more or less. Luckily, God blessed me with this beautiful woman, and she literally dragged me to a continuing education course, which whatever, we take a couple every year. And she's like, we're going to do pregnancy. And I was like, that's so random.
Like I actually drove to her house, made her get in the car and took her to Jacksonville against her will.
For a long time.
I love that. Yeah. So did you guys know each other at Florida? Like, did you know each other from before? Okay. Cause you guys both went to Florida. I said that in our little intro.
That's where we met.
Got it. So you met at University of Florida. Okay. Got it.
Yep. We became physical therapists together. And so really I was shocked by how moved I was in that continuing education course. So to be aware of the fact that there's so many pregnant women who suffered like I did, and so many postpartum women who literally just sat in a corner and cried about it until it finally like put itself together. So to me, that's like the passion behind what I do every day, is because 27-year-old me would have loved to have that. And I just didn't. I didn't.
100%.
You know, something that I always say is like, who's my target demographic? It's like the older, like the younger version of me is my target demo with this podcast, right? I'm like, who am I serving? I'm serving like the younger version of me who didn't know this, who needed somebody to talk to who needed a podcast to like be able to talk about these things. So I love that you tapped on that. And Dr. Luly, so like from what I read, you also had a 4th degree tear, right?
Yeah, that was probably like the least of my complications. So
least, wait, like remember guys, we tear from the vagina to the rectal area, and that was the least of her problems.
Yeah. So same, my first baby, when I was pregnant, I had like this magical pregnancy. Like I felt like I was a unicorn. It was just, it was just great. I felt great. I was able to exercise throughout without like any problems.
Her and Carlos taught a stadium stomper class at UF the day before she went into labor.
Yeah.
That's so nice. I always say to people who, I don't actually say this because it would be rude, but when people are like, oh, I love being pregnant, I'm like, bless your heart. And then I read something that in the South, if you say bless your heart, it's really like saying fuck you.
Exactly.
You feel like a unicorn, Dr. Luly. Bless your heart.
Bless your heart. Yeah, I would say that to myself too. So it was great. Like, and I no pain, nothing, you know. And then my water broke. It was 37 weeks, so it was unexpected. It was a little early, but still, again, within that normal range. Yeah. So my water broke. I thought I was peeing my pants because I had no idea. Was like, I was just like, oh, this is so weird. Why am I peeing myself? And like, it took me all night of like playing this game. Like, why is my bed wet? Gosh, I keep peeing myself until my husband was finally like, I think your water broke. Let's go to the hospital. And I was like, oh yeah, that could be it. So we go to the hospital. Horrible unserious of events that should not have happened. They ended up like inducing me because I wasn't progressing fast enough. Gave me put an epidural at the wrong time. I pushed for 3 hours. The baby got stuck in my birth canal. They used forceps and a vacuum to try to assist him out. In doing that, he ended up with a skull fracture. When they tried to pull him out, he also something happened to his shoulder and clavicle. And they told me when he was born, he wasn't crying. And they told me, they're like, oh, he's going to have severe brain damage. He won't be able to use, I don't remember, right or left arm, one of his arms. And, I was like, and for the first, I want to say 24 hours, they would come into my room with him. Well, they took him to the NICU and they would come in and measure his head to make sure the brain wasn't swelling more. So that was
horrifying.
It was horrifying. It was awful. It was just you don't know what to expect. You're thinking, I was 24. That's the other thing. So like,
and you had the unicorn pregnancy too. You're like, this is amazing. What could go wrong?
I'm in this land of like bliss. And, also when I was in labor, my entire PT class came to the hospital. All 48 of them were at the hospital. And my dad is a deacon, and he had them all praying the rosary because he knew he's also a pediatrician. So he knew things weren't going well. So he had like everybody praying to like for this baby and for me. So after the trauma with the baby, they tell me, okay, like it's time to get up and, go to the bathroom. What they, after you have a baby, they make you pee to make sure that, you can go.
And you have, sometimes they don't let you leave the hospital till you go number 2.
Yeah.
Right.
Yeah. So I go to get up and I was like, oh, I can't feel my legs. And they're like, well, that's normal. Your epidural is going to wear off. We'll help you get up and go. So they help me get up and go. And I go to the bathroom and, they put me back in bed. Then they put me in the regular room. And my son was born like at 3.
Yeah.
Like at 3. And then like at 5, I'm in recovery and I'm like, hey, I still don't feel my legs. They're like, yeah, that's normal. Don't worry about it. I'm like, okay. And then like at 9 o'clock at night, like everybody leaves. It's just me in the room with my husband, and I have to get up and, go to the bathroom again. My husband's just like not waking up. I'm throwing pillows at him. He had a rough day. And like, he's just not moving.
Don't get me started.
And so I was like, okay, fine. I'm just going to get up. And I go to get up and I cannot move my legs. Like I cannot. So I have to like physically grab each leg to move it to the edge of the bed. And I sit at the edge of the bed and I stand up, stand up with my arms and I collapse on the floor. And so then the call bell and the nurses and everybody's rushing in and they send me for like an emergency MRI.
Mm-hmm.
They don't know what they did. I had a panic attack in the MRI. So I'm like, get me out of here. And, this story could go on forever. But what it ended up being was I crushed both of my femoral nerves because of the position I was pushing in. So I was pushing with my knees like up. Can you see? Up to my chest, like both of them up here. And I was in that position for 3 hours. That nobody should be in that position for 3 hours. Your nerves come out through that junction of your hip, and I crushed them. So I had nerve damage and I couldn't walk for about 4 months after he was born. And then on top, I had the tear and the trauma from like the forceps and the vacuum and all those things.
You guys watched The Business of Being Born?
I haven't. But
so many
people are telling us to watch it.
Okay, I referenced this in a previous podcast about how I learned, I had a really skilled midwife teach me how to push properly, from I take a deep breath and I would push almost from my chest down through my ribs, and almost like a toothpaste tube. She gave me this toothpaste tube analogy that you squish it out from the top, not from the bottom. And because that's how you can really hurt yourself. But anyway, the film, for those who are interested in watching it, it's a documentary about the business of hospitals and how their goal is to move women. It's literally the business of being born, the business of the hospital aspect of it. And I'm not knocking hospitals. I've birthed all 3 of my children in a hospital. I think that there are some amazing OBGYNs. I personally love mine, who listened to me and was so caring. But that brings me to talk about Pitocin. How do you guys feel about Pitocin? And either one of you can go ahead and answer this, but I think I have an idea about how you feel about it.
I think it is a tool that could be helpful if used appropriately in circumstances when it's actually, I think it's also used sooner than it should be in a lot of cases. My case would be a perfect example. There was no need for me to have Pitocin when I got it. My labor would have progressed. I don't know, but it should have progressed well without a problem. With my other 2 babies, I did also get Pitocin, but that's because I was not well, myself. So I needed labor to be brought on quickly to, so that for my risk. And everybody turned out fine, and it was used appropriately in those other 2 instances, and my labors are completely different. So that's...
Yeah. What about you, Dr. Kat?
my take.
Yeah, I empathize with that. And to be clear, that decision is completely outside of our scope of practice.
Yeah.
But it is, just having been in the hospital environment for as long as I have, having served pregnant and postpartum women for all these years, I do feel like in general, the interventions not only potentially interrupt what our bodies already know how to do, and thank God, like you said, thank God they're there. Thank God we have ways to help.
Mm-hmm.
But the other thing that kills me as someone who serves postpartum women is it gives this impression like, oh, honey, your body can't.
do it.
Like,
Yeah.
let me jump in. And you're like, but wait, why? Like, is there something wrong? Am I broken?
Yeah.
Is there a time problem? Like, is it bad that I'm still laboring? So it really disrupts our faith in our own bodies.
Yeah.
So that to me is like a harsh, unnecessary thing.
So to give you some context about like why I even brought that up, it's like, so with my firstborn, I delivered also at 37 weeks because my water had broken, and there was a partial break. So he was kind of like still hanging out in amniotic fluid and everything was good and whatever. And then they were like, it's been so long, we have to do Pitocin. And I was like, no, like I refused it.
Yeah.
Yep.
And apparently there's like another pill that they can insert into your cervix, which is not Pitocin, but it does help to speed things along. And so I opted to have that instead. I don't know the name of it, but that exists. The argument was you should take Pitocin because if not, you could be rushed into an emergency C-section. There could be an infection, and then you could be rushed into an emergency C-section. And I remember saying, but if I get Pitocin and my body's not ready to deliver this baby, I could be rushed into emergency C-section also because the heart rate and the this and all of those complications. So I always just tell people that these are our personal experiences that we share and that they should make their own informed decisions and consult with their medical team. And if they have a doula or a midwife, working with them and come up with a team plan and just know what your options are.
Yeah, like what you said right there, like an informed decision. Yes. I feel like, and I don't want to speak for you, but like going into my first birth, I knew nothing. And I was just letting people decide things for me. And I just, want to tell my younger self and like all the people out there, just learn and find out more information you can about this so that you can make the decision that's right for you.
Let's move on to talking about some of the issues that you treat. So, Dr. Kat, did you always know that this is what you were going to do with your career?
No, not at all. So I started out, I did hospital-based outpatient. So I saw in an outpatient setting, adults and pediatrics largely. And then I would go into the hospital several times a week and see any patient from like the NICU, the ICU, the med-surg floor. So any kind of diagnosis, any kind of age. And I did that for like a decade, but we took that specialty course 9 years ago.
Yeah.
So 9 out of the 11 years, I tried to get pregnant and postpartum women to come into the clinic. So I did that, but I think it was like right when I had a handful of pregnant women who had such a hard time getting to the clinic. So one in particular that broke my heart. She was very pregnant and in a lot of pain, but she had a 2-year-old. So like, what do I do? Can grandma come twice a week for 2 hours so that I can get therapy? Like that didn't work. And then too, by the time I saw this woman, because the clinic was so busy, I literally put her in a wheelchair and brought her back to the evaluation room because her pain was so bad that she couldn't walk. So I didn't find out until 5 years into my career that I wanted to do it. And then 5 years later, I was like, there's no setting appropriate for these people. Like this is a whole group of people who are just not being taken care of. Like
100%.
They crawl to the pediatrician appointment because their baby's not going to miss their doctor's appointments. And that's at 2 days, 2 weeks, 2 months, like
100%.
Nonstop.
I remember feeling like that, especially after my first 2. I was completely overwhelmed. I was healing, like my vagina was healing, like everything was like, it was hard. And I'll never forget it. My son's first pediatrician appointment, the elevator was broken. I had to walk all the way up. I'm not
Oh,
kidding.
our,
I'm like, wait a second, my vagina can't handle these stairs.
no,
It's like I can't handle that.
our seat and
Oh
the
my
bag
gosh,
and
Nikki.
Oh my gosh, it was crazy. So, okay, so you provide now concierge services is what you do.
Yes.
So people can people come to your office? Because I'm receiving concierge services. Like just so everybody knows, I receive like Dr. Luly comes to my house. Can people? Is there an office space where people can come if that's easier for them?
So that's a great question.
Yeah.
We do rent out rooms on occasion because there are moms who say their kitchen is being redone or they live with their
Yeah.
in-laws or there's a reason why they want to get out of the house. That's fine.
Yeah.
We have spaces for them.
You all, I want to take a break and I want to take a moment to tell you about how lucky I feel to have found Painless Pregnancy. I started seeing Dr. Luly Diez 2 weeks after I had my third baby, and I have honestly had the best recovery yet. At Painless Pregnancy, their belief is that their services should be the standard of care for every woman, especially pregnant and postpartum women. Some of the issues that they treat are diastasis recti, back pain, hip pain, pelvic pain. They treat pubic dysfunction, numbness and tingling in your arms or legs. They treat general aches and pains, headaches and neck pain. They treat difficulty walking or having a severe waddling gait. They treat balance issues and urinary or fecal incontinence. They help treat pain with sex or other pelvic issues, and they treat prolapse, among so many other issues. Pregnant women should not wait until they are actually in pain or dysfunction to see the incredible therapists at Painless Pregnancy. So many women think that the issues I mentioned are normal or that there is no solution or that their only solution is to have surgery, but that's simply not true. Working with the therapists at Painless Pregnancy can heal you. You all know that we must fill our own cup before we can pour from it. Make your prenatal and postpartum health a priority today by booking an appointment with Painless Pregnancy. You can head on over to www.painless-pregnancy.com and use my code NikkiSpo10 for 10% off of your initial in-home evaluation visit. I want to take a minute to thank our sponsors, Sana Skin Studio. The best way for me to describe Sana is that it feels like coming home. Unlike traditional facials, Sana's facials are rooted in education, and I love this so much. Every experience I've had at Sana has been a chance to learn more about my skin and its needs. I love that the facials are effective while also being accessible enough to be a monthly ritual rather than a yearly splurge. I'm honored to be able to provide our audience with a promo code. Use the code THENOGLOW for $25 off of your first facial at Sana when booking via sanaskinstudio.com. Okay, and so Dr. Luly, like what are we treating here? So like the scope of the practice, what exactly are the things that we treat?
we are treating any range of we like to do from like wellness and prevention to dysfunction. And that could be anywhere from before you're even thinking about getting pregnant up until 45, 50 years postpartum. You know, that's what we say. It is never too late to address these issues. We love the idea of wellness and prevention because this is such a big moment in your life. Getting pregnant, having a child, bringing a baby, another life into this world. It's just such a big deal. And our body goes through so much. And I don't think it's acknowledged, it's just like something that happens. And yes, your body is capable of doing it. And it's not a medical necessarily thing, but a lot of us have very sedentary lives. Like we're sitting, we're working all day, or we're not very active. So what our bodies were back in the day when we were just like having babies and living as like nomads or whatever is different than we are now. So we want to be able to support women throughout their pregnancy and then throughout their postpartum journey so that they can, have good experiences. Like our little line is until every pregnancy is painless. Like pregnancy should not be a painful situation. Mm-hmm. And if you are in pain when you're pregnant, your body's trying to tell you something. Yes. Something is off, something is wrong, and we can make it better.
So when you talk about in early preparation,
Mhm.
like how early do you mean?
So in
Like
my perfect
pregnancy?
world, yeah,
Yeah.
in my perfect world, you find out you're pregnant and you make an OB appointment in the first, like, what, 7, 8 weeks?
Yeah, right.
And then you see the OB once a month throughout your pregnancy. And then at the end, you see him more often. It should be the same with a physical therapist. You should call us when you find out you're pregnant. We should evaluate you, see where your body's at, see where you might have deficits, where you're stronger, where you have less mobility. And then we should work with you once a month, get you on a good program to feel good, feel strong. And then towards the end of the pregnancy, we do birth preparation. Like you were talking about that midwife that taught you how to push. We do that with our moms. Based on their particular anatomy, we do different stretches, we do different mobilizations with their hips, and we teach them how to push. And then we even go over like effective positions to push. So like, I don't know, if you have more tight hips, like, you know how they say like, oh, your hips are very narrow, so you won't be able to push out a big baby. We'll work with you so that your hips have that mobility so you can push out that big baby. So that would be, and then we love to see 2 weeks, 1 to 2 weeks postpartum.
I mean, I think I got you. I think I started working with you guys 2 weeks postpartum.
Yeah, 2 weeks.
Perfect.
That's like perfect because your body just, like, you did more than a marathon, you know? And then that first session, I don't know if you remember, because it's kind of a fog when the baby's so little, but it's like a feel-good session. And it's just like bringing your body back into alignment. And I think I remember as I was working with you, you were like, you know what I mean? And like your body just like melts a little bit and you feel good.
Yeah.
And it's, I think, the first time someone taking care of you instead of worrying about your baby.
Obviously, I talk a lot about how I had 2 vaginal deliveries and now the C-section. Dr. Luly, you and I are currently working on like the scar tissue and the fascia surrounding my C-section scar, but also revisiting some of my hip instability, which had been exacerbated by my 2 vaginal deliveries. So first, I want to know, why is it important, and either one of you can answer this question, why is it important to treat the scar area for cesarean moms?
I would say, if I can give a quick example, one diagnosis that I saw a lot in the hospital is a total knee replacement. And if you've seen those scars are massive from above your kneecap to below, and they're thick. The main goal is to get that knee to bend. And once we started, like the clinic I worked at, really including the massage and the soft tissue release around that scar, the knee moved so much quicker. So that experience burned in my head. And then I noticed, a lot of moms talk about the shelf. They call it like a shelf. They stand up after a C-section and you feel like the top, like
an overhang.
Yes, it's glued in and the rest of the belly hangs over. That's like a lack of mobility. So if you can have a scar, but if it heals with all the layers sticking to each other instead of being able to move within, then you're going to have, it can be functional, but can be funky looking. The other thing too is that scar is deep and low. So your hip flexors have a chance of being involved, your organ mobility. So we still use our uterus. Like, I have no intention of creating more people, but uterus needs to grow and shed every month. So I'm still asking for things of this organ that's been cut through, right? So I have to be able to move it for freedom.
And your bladder.
Oh my gosh, your bladder.
Your bladder is like right there, like where they cut.
Should we show her how close it is?
Show me. I love that you guys have all this stuff.
So like your bladder is right under your uterus. And then
is that how big a uterus is supposed to be?
When it's the size of your fist?
Yeah.
That looks like a miniature uterus. I feel like mine is the size of a big old balloon right now.
Yours is probably back to normal now.
7 weeks.
7 weeks.
Should be.
Yeah. All right.
Okay, so
that's your bladder.
Where you cut.
Ovaries, uterus, and then bladder. So, and then there's like a lot of fascial sheaths that connect the 2 organs together.
So think of saran wrap. Mm-hmm. You know, when you put saran wrap over meat, that's like what your fascia is. It's like the wrapping of your organs and muscles and stuff.
Okay, that's a good visual. So for those of you who are not tuning into the video version of this episode, we're thinking about fascia as putting saran wrap over a piece of meat. That's what the fascia is.
Yeah. So these 2 organs sit right inside, like they're almost parallel, the bladder, to your pubic bone, that lowest bone in your body. And if that bone has hurt you before, you know exactly where it is.
Yeah,
so
totally.
when they
That
cut,
bone hurt me during this pregnancy.
Yeah, that's
I got
really
a lot of tension on my pubic bone. I was like, oh.
and so it's right there, so it goes deep. But I mean, like you can see your pelvic floor muscles are all holding your uterus, your hip flexors. So I mean, there's just sorry, the colon may fall out. There's just so many structures that are involved.
Right there.
Yeah. Anatomically speaking, super, super close.
So when they cut for the C-section, they cut like right on that uterus, and they cut through 7 layers of tissue, and not necessarily cut, but they go through 7 layers of tissue. And when it heals, it doesn't necessarily heal each layer independently. Right. Sometimes like when it, again, like I'm such a visual person. If you think of a plastic bag, have you ever like by accident left it on the stovetop and it melts together and it kind of just bunches up in the wrong places?
I've never done that, but I can imagine it.
I am the bad person that does that.
You would totally do that.
Clearly, okay, Dr. Luly.
I know how you put plastic bags on fire.
I have 3 kids. It get a little
okay, yeah, I know. Shit happens. We get it. Okay, so you melted the bag, and that's what it happens. And now that relates to the work that you do. I love this conversation.
So it just melts, and it doesn't necessarily seal how it should. So the same thing happens with your scar tissue. Each layer doesn't heal independently. So we want to make sure that as it heals, we're doing the soft tissue massage to break up the adhesions between each layer of tissue.
I mean, I have to tell you, like, I'm 7 weeks postpartum, and obviously, like, yes, like my genetics play a role, and I was a fit and healthy and active person from before, and I always have been my whole life. And I eat pretty clean now. I'm not by any means like starving myself, but I will say that I don't have that shelf happening right now.
Yeah.
But we've been working at that every week. We've been working at it.
Yeah. And we started with like some lymphatic stuff to get the swelling done. Also, like, I know if you don't mind sharing, like you had some numbness, right?
Oh my gosh. Yeah. So that's another thing that I do want to talk about, like the scar being numb.
Yeah.
And that happens for a lot of people because you're cutting through nerves, right?
Yeah,
absolutely.
Yeah, numb. And then also like the aversion, like a lot of people, they're like, don't want to touch it. It grosses them out. They just have like a bad, you didn't really have any of that because I think you prepared so well for your C-section.
Oh my gosh, I went into my C-section, like emotionally, psychologically, like I went into having a C-section in a really, really good place. Like I did a whole podcast episode about how I prepared to have my C-section. So I don't personally have a lot of trauma about number one, having a C-section or my scar. I'm like, oh, this is cool. Like I did that. But in your line of work, I'm sure you've come across so many women who have had traumatic C-section experiences. So Dr. Kat, how do you go up against something like that?
Yeah, that's a great question. So we do find that at any point in the birthing process, if that birthing mom feels or hears or sees anything that can be interpreted as emergent or traumatic. So we freeze. You know how the neurological response, like if there's a danger, you fight, flight, or freeze. Our tissues do the same thing. So like say if we have a mom who had some kind of trauma or scare while they were pushing, their hips can get stuck in the birthing pattern. So, you know, this is the back of a pelvis. This is the back of your pelvis. Your hip bones, your sit bones come way apart. And do you mind with my tailbone, please? Yeah. Can you move it? The tailbone comes way out. And you see how much more space there is there? Those bones separating, that's a beautiful, wonderful thing. That's how the baby can exit. They can get frozen like that. And so same thing with, yep. Yeah. So just orthopedically, I mean, those bones get stuck, but we touch so much and we feel with our hands and we connect with these women that we know that there's some like energetic holding there. And so it's a normal response in our bodies. If we experience danger, we freeze. So same with the C-section. If it's an emergent situation, the tissues in the abdomen, like their whole neurology is different. Yeah. So, you know, we're not mental health counselors by any means, but we do really show up fully for these women in their rehab. So we'll do the soft tissue work, we'll do the bone releasing, but then we can even just give them really simple strategies. Can we share one here? Like use? Yeah. So we can lay our hands on a scar that's from trauma or something interruptive, and we can just say, I want to ask these tissues to release any trauma or tension that they hold, knowing that you're safe and your baby is safe and he's out. And so even just like, I mean, those are words, right? But words with touch, and then giving mom permission, she might not even know. It might just kind of be over here that she's frozen and she's still like processing. So she's going to have to still process, right? There's other professionals for that. But giving those tissues permission to relax and then start their healing journey has been a game changer.
A couple of years ago, I had a conversation with a friend of mine who was going through menopause at the time. And she was confiding in me that having sex with her partner had become so painful. And this was a while ago, and I feel like people weren't as open about it as they are now, but I could see her despair and her frustration and almost like her shame. And I distinctly remember her trying to change the subject really quickly by saying like, "Oh, but you're so young, you don't want to hear about all that drama." And I remember thinking, wait, no, I want to hear about the drama so I can help myself. Like, I want to have sex for a long time in my life, like without it being painful. So it's so wild how like life works. And fast forward to so many years later, here we are, I'm connecting with you and we're able to have this conversation. There's two questions on this. Why does this pain exist specifically for menopausal women?
So this area of aging has a lot to do with hormone shift, right? And so from my understanding, it's the lack of estrogen that causes the vaginal tissue to atrophy and dry up. So it's those two components. The tissues are not as plump and the area is not as well lubricated.
And is this something that you are able to treat?
Yeah, so we treat that all the time, yeah. Mm-hmm.
Okay, because like then there's like, there's these pills like that will help you and just have a bunch of lube and like, but like, what is it, the underlying treatment? Like, so there's superficial treatments for everything. Obviously like medication and medicine in general, thank goodness we have it and that we can treat certain ailments with medication. But how do you treat it naturally?
We love to take like a multidisciplinary approach. We work a lot hand in hand with gynecologists, obstetrician, urogynecologists. Yeah. And what we found is when you work as a team to address this kind of issue is when you have the most success. Because sometimes you do need like some hormone replacement, but it doesn't necessarily have to be ingested. Like some of these women do great with just topical estrogen or they do good with some kind of like more direct approach to the area as far as injections or something like that versus like a systemic thing.
Yeah.
And I think the main thing is really to figure out why, like what is the cause of the problem, fix that instead of trying to put Band-Aids here and there and like hold everything together. Mm-hmm. Like, it's so funny. I had a mom tell me, she's like, I'm holding it together with glitter glue and and Band-Aids. And I was like, oh my God, that just stayed like in my head so much because I could feel like that. She's like glitter glue and Band-Aids. And
like trying to smile. Like I like give her that because she's like trying to make it cute.
And I think so many of us women try to do that. Like your friend, she's probably like, ha ha, it hurts so much. And like, we try to laugh it off. Like it's a big deal. Or we're like, oh, it's just normal. This is part of my life.
Right. And like the rite of passage.
And it's not. So that multidisciplinary approach, I think, is the most helpful. And then what we do, like specifically, is we work with the bones. So again, because we're such visual people, all these bones have the muscles attaching to them. So like you can see, like they're attaching everywhere. So if your bones aren't in the right place, it's going to pull and then there's going to be a stretch on that muscle. And, just think of having a tight muscle and then something going into that tight muscle is going to be more painful. Another good analogy is like if you make a bicep, like flex your bicep and poke it. So go ahead and do that. Like and now relax your bicep and poke it. So it hurts when you flex your bicep and poke, right?
Yeah. You feel it more.
So, same thing. So if you have tight pelvic floor muscles, it's like those muscles are always flexed. So if you're trying to have penetrative sex, when that penetration is coming at a tight muscle, it's painful. What we do is we try to get those muscles to relax so that it can be more enjoyable.
A second part to this question is how common is it for pre-menopausal women to experience painful sex after having had children?
I think the stat that I read is like 8 and 10.
Yeah, it's really high.
Whoa.
Really high. And it's fascinating too, because we touched on this at the beginning. A lot of us feel like with a C-section, that area is spared. And so it is worth saying that C-sections have a lower rate of pain with intercourse, but it's not zero. And even less, so pain with intercourse is just one symptom. Like they have a lower rate of pelvic floor dysfunction, but it's not nothing. Like they can still pee their pants. They can still pass gas or bowel when they don't want to. They can still have pain with intercourse, tailbone pain, all those things. So yeah, it's really common postpartum. I think, I don't know if this is supported with research, but I have seen our age group, pre-menopausal and like postpartum, recover quicker with the interventions for pain with intercourse. For our group, our population that we serve, this pain with intercourse isn't only like a conservative approach will get better, but it's quickly too.
Right. Yeah. So, usually, and then going back to that trauma, and that like what you were saying at the beginning of like when we just started, like, I don't want to have sex. Like I just like a whole person went through there. Like, you know what I mean? So just,
oh my gosh, there's so many things to think about.
Yeah.
Yes.
And just giving moms the space. I think that's like holding space for them and to feel safe and just talking about this and like sometimes just saying those words out loud, like I'm so scared or I'm not ready and being like, you don't have to be like, just because you're cleared at 6 weeks doesn't mean like you got to jump back into exercise and sex and, all the things. It just means that your body has healed and it won't be dangerous for you.
Yeah.
It doesn't mean you're ready, and that's a conversation you have to have with your partner.
Yeah.
I hope you guys are ready to get like really graphic here. And yes, for the listeners, that's your heads up that we are going to get graphic. So if you don't like that shit, you just, pause for a minute, fast forward. We're going in right now. But Dr. Luly, in your bio, you mentioned that you guys treat prolapse. And I don't think everybody even knows what that is. So go ahead and define that for all of us who live under a rock and then tell us why the F this happens.
Yeah. So prolapse is when your internal organs are coming out of your body through your vaginal opening. That's probably the best
great.
layman
Beautiful.
That
Short
could
and
happen.
sweet.
Yeah. So there's different.
That's crazy. Can we stop for a minute? That's crazy.
Yeah.
Crazy.
I know. It's so scary. Like what? My insides are literally falling out of my body. Yeah. That's prolapse.
Oh my gosh.
And through your vagina, which is even more horrifying, I think.
No, it is. It is. Why does it happen?
So many reasons.
Yeah,
lots of reasons. But
a few.
Basically, so our organs are suspended in our body by ligaments, by that fascia that we talked about. Mm-hmm. And it's kind of, they're held up. And then our pelvic floor muscles are like a hammock, which is supporting it. So if we lose some of that elasticity of those ligaments, they start to hang lower. If our pelvic floor muscles are weak, aren't doing their job, they're not supporting those muscles. And then we also talked about the atrophy that can happen as you age of your vagina. And then what happens is either your bladder, which is in the front, of your pelvis. So you can either have a cystocele, is when your bladder is coming out through your vagina. You can have a uterocele, which is when your uterus is like coming, this would be the vaginal opening, right? So when your uterus is falling into this opening, or you can have a rectocele. I don't know where our rectum went. We're just throwing body parts around here.
There you go. Where my rectum went.
Yeah. Or here, like your rectum could be caving in to this, like, because they're right here. So it's when the rectum caves into the vaginal opening. So it could be one of the three. It could be all three. It could be two of the three. And there's different degrees of it. It's same as the tears. It's graded 1 through 4. 1 is just that it's like low lying. 2 is that you're seeing it, but you don't come out. 3 is that they're coming out
at the door.
And 4 is that they're all the way, not the whole organ through, but like they're bulging. So if you're showering or, wiping yourself and you feel a bulge coming out, it could be a prolapse.
Like this, just hearing about this makes me so sad, because I feel like if somebody were to get to that point, I can only imagine how hopeless they might feel, like how frustrating and how hopeless. And again, like talking about the shame, and we live in I think it's getting better, but like all our lives, for the most part, this is a male dominated world, and we're taught to like be pleasing to men. Right. And that is a lot of where our worth lies. I've talked about that. Like I would be lying to you if I said I didn't think about it when I was going to have 2 vaginal deliveries. I was like, oh my gosh, is this going to mess up sex for my husband? Or like, is this going to am I going to be loose? Am I going to be, I think that women collectively, we're starting to move away from that and really take ownership of our bodies, and knowing that sex isn't just about being pleasurable for men, but also for ourselves. And that pelvic floor health in general isn't about the dude, or isn't about like your partner. It's about our personal well-being. After my firstborn, I bought vaginal weights on Amazon, and there was a set of 8 weights, right? And I'm like, man, my vagina I'm good. Like I had this baby, but I bet you I am so good. So I was like, I went in, if 8 is like the heaviest and 1 is the lightest, I went in with like a number 5 or 6. Okay. So I insert this vaginal weight in, and I'm standing. You're supposed to do it for 10 minutes. That's what the instructions say, is like try to hold the vaginal weight in for 10 minutes. I put that thing in, and it just went pop to the floor. It fell right out, and I cried. You guys, I cried. Right. And I was very humbled. I was like, maybe the pee isn't everything that I thought it was. I was like, that brought me down to earth really quickly. And I was like, maybe let me start with number 1. So I did the number 1. And I will say, and this is where the hope comes into play, and this is like before your type of services were ever on my radar. You know what I mean? Like I didn't know shit. Like I'm like, vaginal weights is all you can do. So I started with number 1, and I did my little exercises, my Kegels, and I worked my way up to the heaviest weight, but it took a lot of patience. It took a lot of humility, right? I was like, okay, we're not there yet. It was like, and it was true recovery. It was true recovery. And like, I share that story because I can laugh about it now, and I don't have like shame or embarrassment about it, when at the time my son is almost 5 years old. Like, so that's almost 5 years ago. Like I did have a tremendous amount of shame and embarrassment and fear. And like, what if this bothers my spouse? And I just simply like, don't think that way anymore. And I want to see more women come into a space of that, where they start to really take care of themselves for them.
I mean, we hope so. That's really like
that's the dream, Nikki.
It really is. Like
that is the dream.
Going back to like our personal stories, like the reason like I really do this is so that nobody has to have an experience like I had. Like nobody needs to do any of that. So if I can, and I know I'm like an extreme case, but like if just like one mom can avoid that, like I would be like, okay, I'm good. Like I did my job.
You guys, I'm so happy to have you both on the show. Dr. Kat, Dr. Luly, you guys are amazing. So remember, this is Painless Pregnancy. I'm going to include all the information in the show notes so that you can reach out to them. You guys serve up to how far north? Because you guys are in the Miami area. You serve all of the Miami-Dade County area, but how you go in either direction? Up to Palm Beach. Amazing. And for those of you who are listening out of state, like there are doctors and physical therapists like this out there. They do exist. Like get it on your radar, pay attention. This podcast should put this on your radar, that you can find help and healing whatever stage you are at in the process. So I'm just so grateful to you both for sharing your wealth of knowledge with my audience. And hopefully by doing this together, we can help heal women all around us.
Yes, that would be amazing.
Yes,
thank you for having us.
Yeah.
This was great.
My pleasure.
And for sharing, our mission with everyone.
Yeah. And for your vulnerability, because honestly, Nikki, it's because of women like you,
Yeah.
this word gets spread more than it would have otherwise. So thank you for doing what you're doing.
Big thank you to my friends at Painless Pregnancy who have helped me have a truly painless postpartum experience after my C-section. I am seriously so very grateful to have found them, and I want every woman in town to know that these services exist and are available to them. Head on over to www.painless-pregnancy.com and use my code NikkiSpo10 for 10% off of your initial in-home evaluation visit. This podcast was brought to you by Sana Skin Studio. Be sure to use my code TheNoGlow for $25 off of your first facial at Sana when booking via sanaskinstudio.com. More than a skin studio, Sana is a movement towards healthier skin and self-love. Thank you so much for listening to The Know. If you loved this episode, go ahead and share it with a friend. Words are so powerful, and someone may need to hear what we covered today. And if you really loved this episode, please take a moment to rate the show and leave a review. Your comments are so important and valued, and they give other listeners insight on what to expect on The Know. You can connect with me personally via Instagram at NikkiSapSpo and The Know with Nikki Spo. My hope for you today is that you are fearless in looking inward so that you can be your highest, most authentic self and go after the life of your dreams.